Good afternoon, everyone, and welcome to the 2021 edition of our breast cancer awareness session today. I am delighted to welcome Dr. Dora Dimarcut from Mediclinic, who has agreed to do the session for us today. As part of the session today, if you have any questions, please use the box at the bottom of the screen on your right entitled Q&A, and I will run through the questions at the end of the session, so not to interrupt the doctor with a session. So Dr. Dora, I'll let you get on. Good morning.
Good morning. Should I start now?
Yes, please, Doctor.
So you can see my screen and you can hear my voice well?
We can indeed, yes. Thank you.
Thank you, thank you. So good morning, everyone. So thank you for giving me this chance to share some insights and inputs regarding breast cancer. So we are celebrating Breast Cancer Awareness Month. Okay, this has been an ongoing project. It started way back in 1985 as part of the American Cancer Society joint venture with a pharmaceutical company to raise awareness for breast cancer and also increase funds for research. So breast cancer, usually 1 out of 8 women will have breast cancer. So if we compare it to the incidence way back, let's say in 1975, okay, you can see that it has gradually increased. There is about a 0.5% steady increase in the incidence over the years. Okay. In the US, this is the second leading cause of cancer deaths in women, but globally, this is actually the #1 leading cause of cancer deaths in women. You will see here in the next, in this slide, all areas colored in pink. It just shows that the #1 cancer for women is breast cancer. And you can see, like in other parts, we have here cervical cancer as the #1, but predominantly all over the world, the most common cancer for females is breast cancer. In last year, in 2020, among all the diagnosed cases of cancers in females, 25% account for breast cancer, and followed by colorectal and lung cancer. Out of 2.3 million cases of cancer last year, 2.3 million cases of breast cancer last year, we also have reported like 680,000 deaths for breast cancer last year as well. So there's about a mortality rate of about 2.7% every year. So what causes breast cancer? Essentially, there are changes in the genes or in the cells. We call it mutation. So from a normal cell, it becomes an abnormal cell, and then it just proliferates and grows into cancerous cells. The exact cause is still unclear, but what has been identified are risk factors that predispose women to have breast cancer. So for the risk factors, we have the controllable ones, those that we can modify, and we have the uncontrollable factors. So these are the things like our gender. So being a female in itself is a main risk factor for breast cancer. Age, which we cannot change as well. Genetic mutation, so this refers to genes that predispose for breast cancer, and the most common ones are BRCA1 and BRCA2. Family history or personal history of breast cancer as well. So in the next slide, we will see here that being a female is the most common one, risk factor, followed by advancing age. Okay. So these two alone, without the other risk factors, these are the most common identifiable risk factors in more than 40% of cases of breast cancer. You will also note here that we have radiation exposure as an uncontrollable risk factor. So these are for patients who've had radiation therapy for other forms of cancer, like between the age of 10 to 30 years old. The breast density, which we cannot change as well because it's the natural makeup of a women's breast. If you have more like breast tissue, lobular or the glandular tissues in comparison to the fatty cells or fatty tissue of the breast, it gives you a higher risk of having breast cancer as well. There are certain ethnicities also that cause increased risk for cancer, like Usually for Asians, you have a lower risk of acquiring breast cancer. Now, with regards to menstrual periods, I just want to point this out for our female audience. So usually what happens is the younger you have your menses and the older you go into menopause, which translates into more menstrual cycles, then it increases your risk for breast cancer. So based on studies, if you have your periods less than before you reach 12 years old, and you go into menopause, let's say after 55 years old, then your risk for breast cancer increases. Now you will see here, this is a graph showing the incidence of breast cancer in certain age groups. Okay, so you will see here, there's a drastic or a doubling effect from like 35 years old and the 40 years old bar graph. Okay. So they say that usually the risk increases by twofold in comparison, like when you're younger and as you enter like the 40-year age group. Okay. And this is the main reason why the screening usually starts at age 40. And in the 40 age group as well, that's the time that when you do your regular screening, that's the age group where the incidence of deaths are become low. Okay, so it's very important to do the screening test at this point. I would also want to point out that the breast cancer usually peaks around 50 years old and 60 years old. And we usually see cases as well, like even if you go into advanced age, even if you're in your 80s and your 90s, that's why the screening is important as well, even as you get older. You don't stop at certain age. It's not like something like screening for cervical cancer where we can stop at age 65. But for breast cancer, we need to carry on for as long as we're healthy. So what are the risk factors that we can control? Most of the time, these are like factors that related to lifestyle. So drinking alcohol, okay. When you drink alcohol, in comparison to those who do not drink, you increase your risk by 7 to 10%, more or less, if you're taking one alcoholic drink per day, okay. And then it increases to 20% if you take like 2 alcoholic drinks per day. So this is something that we can change, okay. Being overweight or obese or not being physically active, this usually is associated with increased number of fat deposits or fat cells, like in the form of cholesterol. Because like your fat cells may convert to additional female hormones that then increases your risk for breast cancer. In the same manner, when you're taking like birth control pills or your hormone replacement therapy, because these are exogenous sources of hormones, it also predisposes for a higher risk. Not having children, not breastfeeding, because you're having, during these times when you're not breastfeeding, you're not actually like having periods, okay? So those times that you're not having periods, it's actually protective for you. So if you're not breastfeeding, and let's say you don't have any pregnancy because there's no rest period, your menses, you're having like monthly menstrual cycles, so it increases your risk for breast cancer. Okay, we also have something like controversial or unclear relationship. So for example, like vitamin supplements or diet or things that contain like exogenous or estrogen-like properties. So we can, in fact, give an example like soy-based products. Okay, there was a time before that they would say not to take it because it increases your risk. But like recent studies say that if you're taking moderate amount, let's say of soy or tofu, it should not increase your risk factor. So there's really no strong evidence with regards to this. Smoking generally, it also increases the risk for other kinds of cancer. But the evidence that we have is only suggestive, okay? However, because it's something that we can control or change, I think it's still worth taking note that if you smoke less, then you decrease the risk for breast cancer. Night shift work is unclear, okay? Breast implant, this is a common question that female patients would always ask if they are at risk for having breast cancer when they're using breast implants, okay? Not for breast cancer, but it predisposes you for a different kind of cancer. We call it lymphoma. So there's no clear association between the use of breast implants and increasing the risk for breast cancer. And we also have some disproven claims with the use of antiperspirants and use of breast shears, say they do not increase the risk for breast cancer. Now, having discussed the risk factors, how do we know that we have breast cancer, or what symptoms does it usually present with? The most common symptom usually is the presence of a lump in the breast or even in the axillary or the armpit area. So we have to check for any skin changes, whether if there's redness over the skin, there's flakiness or like eczema-like properties over the skin. Okay. There's tenderness or pain on the breast area. Okay. We also have to check the nipple if like there's any unusual or bloody nipple discharge. So these are the most common symptoms that we have. Okay. Any kind of abnormality that you have noticed. Okay. So it's always worth checking with the doctor. Okay. That's why your breast examination is important, because at least you have a basis or a baseline on how the breasts look like or how your breast feels like. So now that we have seen like symptoms of breast cancer, so how do we diagnose it? There are certain modalities that you can use. Okay, so most common, we have the mammogram as a screening tool, but in the presence of a lump, okay, especially if you're less than 40 years old, the breast ultrasound is the recommended modality to use or diagnose for any changes in the breast. Okay. We also have the breast MRI, and we have like newer techniques like a 3D image of the X-ray, or we call it the breast tomosynthesis. Now, once we arrive at the diagnosis, and usually this can be confirmed sometimes even with biopsy. Once you have the identified lesion, then you just take a tissue sample so you can more or less identify what kind of cancer cells you have, if any. So now we go into treatment. So the treatment basically, it depends largely on the stage of the cancer, meaning is it confined just to the breast? Has it affected other areas of the breast? Has it affected the lymph nodes and the cancer has spread in other areas? Or has it affected other parts of the body? We also have to factor in the size of the tumor, okay, and the involvement of the lymph nodes. So most common treatment for early stages of breast cancer would be like surgery. For surgery, either you go for lumpectomy, so meaning you just take out the abnormal cells or the abnormal tissue, or you can go for mastectomy. Of course, this depends on the assessment of the breast surgeon. In combination with surgery for early stage cancers, you also use radiation therapy. Okay. You also have other options like chemotherapy, hormonal therapy, and targeted therapy. For both the hormonal therapy and targeted therapy, we need to identify the kind of cancer cells that you have in the tissue sample. So these are the newer ones, the form of treatment that we have right now. So in fact, it's the reason why like the survival rate for breast cancer has gone higher considerably. So you will see here if breast cancer is diagnosed early. Okay. So the survival rate for localized lesions, meaning for those only found in the breast tissue itself, is about 99%, between 90 to 99%. For those that has a little bit of spread, okay, but not in other organs yet, so that's about 86%. And for advanced stages, you have a 5-year survival rate of 28%. So if you look at it on a 10-year time frame, okay, for those that's non-metastatic, meaning that those that haven't like spread to other parts of the body, you still have a very good survival rate of 84%. So it is key to do or identify the breast cancer very early on. So now we go to screening and early detection, because as it is, this is the only thing that we can sort of control or do for ourselves. Okay, screening is essentially like doing the test even without symptoms. So most females would come to me like when they have something already, and you miss the optimal time of screening. So if you miss this, then of course the risk of not picking up early changes predisposing for breast cancer is there. So early detection means finding and diagnosing a disease earlier than if you'd waited for symptoms to start. So when you do the screening and early detection, it's important to establish is the patient average risk or is she at high risk for breast cancer. The main difference between an average risk or a high risk patient for breast cancer is essentially your family history or a diagnosed case of genetic mutation. So for average risk patients, usually you don't have personal history of breast cancer, meaning you haven't had previous diagnosis of breast cancer. No strong family history of breast cancer. This pertains to those family members who've had breast cancer at an early age, meaning less than 40 years old. Family members, male family members, that puts you at high risk. Okay. And if you have many in your first degree relatives who have breast cancer, so those are like, that goes for you for high risk breast cancer. So if you do not have any genetic mutation as the abnormal genes like BRCA1 or BRCA2, and if you do not have any chest radiation before 30 years old, then you're average risk. Average risk patients usually start their screening at around 40 years old. Okay. The recommendation is to start as much as possible at age 40, and you have the option to do it like once every year, annually, or once in 2 years. Okay. But when you reach 45 to 54 years old, it is important to do it on a yearly basis. Other cancer societies, so this one is based from the recommendation of the American Cancer Society, but other cancer societies would push for a yearly screening or yearly mammogram from age 40. When you go reach 55 years old, then you have the option of either going for a yearly mammo or like mammogram every 2 years. Of course, this depends on the assessment of the gynecologist or the breast surgeon or the breast specialist. And when do we stop screening? Screening is usually advised to be continued for a long period of time while you're still healthy and is expected to live at least 10 more years. As I've mentioned earlier in the bar graph regarding the incidence of breast cancer at the older age group, you would still see breast cancer cases even as far as 90 years old. Now for the high-risk patients, I have mentioned that usually they pertain to confirmed genetically presence of genetic mutations. So if you have a known BRCA1 or BRCA2 mutation, or a relative is confirmed to have such, okay, then that puts you at higher risk. If you've had, let's say, radiation therapy for some other forms of cancer between the age of 10 to 30 years old, that puts you at higher risk. If you have certain medical conditions, the ones here like Li-Fraumeni-Cowden syndrome, these are genetic disorders that predisposes for breast cancer. If you also have a lifetime risk of breast cancer of more than 20%, okay, then that puts you at high risk. And we can only establish this by using like breast risk assessment protocols or tools. So usually the breast specialists would have this, especially for those who have very strong family history. For high-risk patients, the earliest time that you can screen for is at age 25, and it's usually done with the MRI because it doesn't have any radiation. As much as possible, we do not want our patients getting exposed to too much radiation at an early age because the radiation in itself can predispose for breast cancer. At age 30, you can start doing the MRI of the breast together with the mammogram. Okay. And similar to average risk patients, you need to continue for as long as you're in good health. Okay, so now we have what we call early onset breast cancer. So what happens to those people who we cannot screen before the age 40? Okay. There's about 5% of breast cancer, of all the breast cancer cases, about 5% would occur under the age of 40 years old. It's quite difficult to diagnose because for one, you don't screen before age 40. Second, usually the breast tissue are more dense, meaning it's more difficult to assess or to even examine, or even with mammogram alone, okay, it's hard to see through the dense areas. Okay, so that makes the diagnosis more difficult. And obviously, sometimes also like for younger women, usually maybe it's because they're busy or because of lifestyle, you ignore the early signs and symptoms. Unfortunately, for cancers occurring before age 40, it's usually the more aggressive type. And this relates to cases like you're more genetically predisposed. The issue with early onset breast cancer lies in the after treatment, because obviously it affects your sexuality, fertility, and plans for pregnancy after treatment. So what can we do aside from doing your screening test? Okay, you can do your self-breast examination. Okay. So the self-breast examination, it's not really used as a screening tool. There's little or no evidence that it finds breast cancer early. Okay. But it is basically used just to be aware of how your breast looks like, how your breast feels like. And if you do it on a regular basis, then more or less you would have an idea that there's something different. And then of course you can check with the doctor after that. There are several ways by which you can do self-breast examination. So first is visual or inspection. And then of course, second is palpation, or you feel for your breast. You can do your self-breast examination by, looking at the mirror either with your hands up, okay, above your head, on the side, or on your waist, or leaning forward a bit, okay? Because since the breasts are dense tissues, okay, in these different positions, sometimes you would see like certain changes, or let's say dimpling, or if a mass is pulling the skin over on certain positions. With regards to palpation, you usually use like your fingers, the finger pads here, 3 fingers, and there are several methods on how to systematically do it. It is very important to do your test very systematically so that you don't miss out on any lesions. So there are 3 ways. Imagine your breast is like made up of multiple wedges, okay? So you essentially palpate from the outermost portion going inwards, okay? You can also like imagine having a clock. So maybe you start at 12 o'clock, outwards, inwards, maybe 2 o'clock until you do the entire breast. Another thing that you can do is to check by moving your fingers up and down from one side of the breast until the, let's say from the inner portion till the outermost portion. So in this way, if you do it systematically, the chance that you'd miss out any lumps is less. And the final one is like a clockwise method. So you do it from the outermost portion of your breast and work inwards. Your self-breast examination is actually recommended to be done from age 20. Okay, so you can do it like every month after periods. Okay, you can do that and check for any changes in the breast. Okay, the difference between a self-breast examination and a clinical breast examination is that a clinical breast examination is done by a doctor. So in the younger age group, some would advise to do it like once in 3 years if there are no symptoms or if there are no changes. The importance also of doing self-breast examination is timing. So you usually do it after periods where there's less pain and the breast also doesn't feel so congested. So now these are the ways by which we can sort of identify if there are any early changes for abnormalities in the breast. Okay. So there are just like some key points I would want to point out. Okay. So that we can effectively reduce the incidence of breast cancer or the mortality of breast cancer. So screening and early detection is key. So we have to know which factors we can control or modify. So, and this usually pertain to lifestyle changes or environmental factors. We have to do regular self-breast examinations just to identify and familiarize ourselves with how our breasts feel. And then of course we need to do the screening test. The screening test, I would suggest that you do it on your birth month so it's easier for you to remember. There's always a point of reference. Okay? So if you do it on your birth month, it would be easy that way. You won't miss out your screening test. And then finally, of course, when you're in doubt with anything, with how your breast feels like, or if you notice early changes, then the best thing is to seek professional opinion or consult with them. So these are the main key points that I would like to share with regards to Breast Cancer Awareness Month. So thank you for listening. And if you have any questions, then I'll be more than willing to answer it for you.
Dr. Dimarcut, that's very kind. Thank you very much for this. It's terrifying, but at the same time, it's good to remind people about this. I think I'm going to make breast cancer awareness every month, not only October. For those of you who are still on, it wouldn't be a full a webinar for Holborn if we didn't mention the other side of, unfortunately, cancer, which is the financial side. As you know, we are an insurance broker here. In terms of prevention, obviously prevention is always better than the cure.
Yes.
I would mention the fact that please all of you check your medical insurance is adequate enough should anything like this happen to you. I mean, I would imagine, doctor, you have seen people that have not got adequate medical insurance, and the treatment can be quite expensive and lengthy. So there are three types of medical insurances in this market. One is local, with restricted access to some of the hospitals. The other one is a regional one, which is a little bit further afield, but still in the same region. And another one that is international. International usually doesn't cover the US. I hear a lot of people wanting to the US to go and get checked, etc. If you wanted alternative treatment, that is normally not included on your medical insurance. The other thing that you can do is look at critical illness insurance, which is, it has been actually invented by a doctor, funny enough. It wasn't invented by one of us in the insurance business. It was invented by Dr. Maurice Barnard in 1983 in South Africa, because he had enough of seeing his patients going back to work too quickly. Now, we've not touched much on stress today, doctor, but I would imagine stress has a massive effect on not only treatment, recovery, but also getting the disease at the first place.
Yes. Yes, that's true.
Yeah, so to alleviate stress, and we've all had money worries, and COVID-19 has been very prevalent in the last 2 years, and I think it's taken away the fact that cancer is a much bigger epidemic than actually COVID-19 is. We are lucky enough to be in this part of the world where if you get seen by a doctor, you probably will get your MRI in a couple of days later at the maximum, whereas in the UK, for example, there are 55,000 people on waiting list for hospitals having to wait 3 to 6 months to be seen. Critical illness is an inexpensive way of preventing that financial stress happens should you get sick, and it pays a lump sum on a diagnostic of 35 different illnesses, including breast cancer. If you haven't got it and you're still on this call, please talk to somebody at Holborn Assets on a personal basis. It's inexpensive. It starts at $25 a month, and that ensures that the bills are paid and extra treatment can be paid. I have been faced with people that actually had the treatment that they could afford and not the treatment they deserved. And I think we all deserve the best treatment for ourselves. So if you have any questions about that, please email us at Holborn Assets. No other questions, Dr. Dimarcut. So I'm going to thank you before we end this. That was very informative. And hopefully, I have got a question now, actually.
Yeah, sure.
What is the cost of different forms of breast cancer therapy?
Actually, I'm not really particularly sure about the exact cost, because like for most breast cancer treatments, okay, I'm not the one who's doing the treatment, because we usually refer to the oncologist. Okay, so after surgery, so the surgery is done by the breast surgeon, after which she would be referred to the medical oncologist, who would decide like what kind of medical treatment she would need. Okay, so with regards finances, I'm not really sure about how much it would normally cost, like but most of the time, like for some patients that I see, okay, because it can be quite expensive, so they use up immediately like your limits for treatment, even like after 1 or 2 cycles. Okay, you can even take your insurance.
Yeah, I mean, it's
maybe we
difficult
can.
because
I would probably ask like our insurance as well and check that. And it's a good idea that you did mention about like the cost of treatment and care after diagnosis, because it's worth noting, and maybe I can discuss it with some of my patients to check their insurance as well, because it's really because the incidence of breast cancer has been growing steadily, so it's always better to be prepared.
For sure. I mean, you know, we are in the insurance business. We're financial doctors, unfortunately, and you are the physical doctors. But I would, unfortunately, if something goes wrong and you have to go and see your medical doctor first, it's too late to go and see the financial doctors like us. I always say, you only save for the sunny days. You don't save for the rainy days. You insure yourself for the rainy days and you save for the sunny days. Look, we have plenty of options available for the people that are on this call now. We're happy to talk to them personally. I have another question. Is the lump only internally, or do external lumps show signs of cancer?
Well, sometimes, you know, like there are cases like there's not even a lump. Okay, there is a good percentage of like breast cancer cases where there's no lump, and that's why the screening is very important, because the screening, it sort of picks up changes even before you feel something. 90% of the cases of patients who have lumps, 90% of those would not have, it's not cancerous. Like these are benign conditions, majority.
Great. Thank you, doctor.
You're welcome.
I do not believe we have any more. So I'm going to wrap up these sessions by thanking you again, doctor, for taking the time to do the Holborn 2021 edition. There will be one next year again, and we look forward to maybe welcoming you again on the next one next year. For those of you who are interested in preventing not only the disease, but also the financial burden, the consequences and the effect that such a thing may have on your income and your household expenditures, etc., and the stress levels that you may want to alleviate. These policies are portable and have been put together for people that are like us, expatriates in this market, and they're portable back to your own countries. We're happy to talk to you on a one-to-one. So I'm going to thank everyone for attending, and let you go back to your days. Thank you very much for your day. Cheers.
Thank you.
Take care.
Okay, bye-bye.